We knew that we had a problem when we got our NRC employee engagement surveys back, and we noticed that we had 0% of our employees that had the perception that we had a seamless check-in and registration process, so that was our first clue. Then from there we started asking further questions in our monthly employee rounding and asking what our employees felt about that question or where they perceived our deficits were, and so we were able to draw some more information from those employee roundings. We wanted to improve our percent by 5, so to go from 0% to 5% of our employees feeling like they were comfortable with our check-in and admission process. So we contacted the hospital-wide department that does registration, and we had them clarify what they expected our front desk office people to do as acting as registration people. Also in the past year, we had our entire department do AIDET validation, including for our front office staff. We also encouraged them to make sure that they were letting patients know which therapist they were seeing and whether they were checking in either extremely early or extremely late, so that we could problem shoot that, or at least let patients know that they were really early, so that their expectation wasn't that they would be seen soon. Another thing that we did to help our admission and check-in process was to post a sign in front of the secretary's desk that usually does check-in that said, "Stop and please check in here," so that patients weren't slipping by and sitting down without being seen. Another action item that we did to help improve our check-in process was adding an additional laptop. Each patient that registers also has to complete a functional outcome survey, and sometimes this caused some congestion as there weren't enough computers, or that there was patients checking in and registering and people were sort of getting mixed around in the lobby. So we have set up an additional laptop that we can put in any location in the gym to help keep congestion down in the lobby. One comment from one of our employees was that they did not feel that patients that had Medicaid, there was a smooth process to verify that they indeed still had services, as Medicaid can change from month to month. So we initiated a process to make sure that we were checking each month that patients still had the same coverage, or if it changed, we were able to catch that ahead of time. And finally, we were able to reduce our intake form from 2 pages down to 1 page. This helps save time for patients, get them back a little quicker to start working with their therapist. That also cut down on some redundancy of patients writing out their answers, and then in addition, the therapists were asking the same questions. We were able to move our NRC scores for our employees' perception. 0% of our employees were rating us always as having a seamless registration and check-in process. We were able to move that score to 18.8% of our employees feeling like we had a seamless process, and we're rating that now as an always. We are going to continue many of the same processes that we've started, but in addition, we're going to continue to educate our staff that although there might be things that we are unable to manage, or different variables that come up that we can't control, out of our control, that we do have a process in place and we know how to handle them and we know how to manage those. Some of the concerns are that patients do come late, or they don't bring their insurance cards, or we don't have a script for the doctor. So I think part of that is sharing with our staff that those things are going to happen, and but we always have a process in place on how to manage those types of situations.